Ambulance, what's the exact address of the emergency?
RavNet is Rural Ambulance Victoria's new radio communication system. RavNet is a voice and data radio system that improves communication for paramedics, ambulance community officers, community emergency response teams and the dispatch teams.
With the old network there was a lot of dead spots. Here we haven't found any dead spots at all, so just clarity, it's really good. The new RavNet portables are also really good. They're a funky yellow colour, you can see them clearly. They're also a lot more compact and not as bulky.
One patient, female, approximately 30 years.
The RavNet system will make the job of a paramedic easier in several ways. Most importantly, the additional increase in safety features that are the part of the RavNet system, including duress alarms and the interface back to computer-aided dispatch and the ability to actually see where they are.
We're just going to pop a spine board under your legs here, sweetie, and we'll get you out of the car.
Through AVL or automatic vehicle location, it will allow us to get the closest available vehicle to the patient in the quickest amount of time. The other thing it will do, it will allow our emergency management procedures and major incident planning to be enhanced, and that's quite significant, as well as allowing vast improvement in coverage of communications across the entire state.
RavNet provides statewide coverage over a dedicated channel and streamlined status updates. RavNet also facilitates communication between any operations centre and all RavNet-equipped vehicles anywhere in the state. RavNet features improved functionality, better safety and greater coverage than the previous communication system, and is simple and easy to use.
What injuries, Chrissy?
RavNet's very easy to use because the changes to the overall radio package in the car are very minor. In fact, the face of the radio looks exactly the same as what it currently does, and the changes are so easy to understand that it will not make any major difference to the use of the radios in the car.
At the beginning of each shifted vehicle check, the portable radio needs to be associated with the RavNet radio in the vehicle. This procedure is called cloning. Simply enter the portable radio IDs into the RavNet vehicle radio by using the keypad and select your talk group. For your own safety, portable radios must be cloned.
Under the RavNet system that's being introduced, we actually now have one statewide channel, which is broken down into several talk groups or individual channels. A talk group, for the guys in the field, it's a channel that they work off. And that means that they can move from channel to channel very easily, or in the new terminology, from talk group to talk group. But effectively, if they move from Ballarat to Geelong, they're able to swap talk groups or channels just at the push of a button.
With the old system, all of the status updates and messages were sent by voice as a series of numbers. So we had the car number, the status number and the time of arrival. With RavNet, all of that process is replaced with a button press using the status menu on the RavNet radio. And what that achieves is an improvement in response times, because you're not actually waiting for the dispatcher to confirm that they've received that message. It means that we can actually get to the patient quicker.
So the crew will actually press the number, for example, or select the correct status, say arrived or 2-1, and that will actually go via RavNet and feed into the computer-aided dispatch. So it's going to save a lot of time.
Sending status updates using RavNet is easy. There is only one button to press and the dispatcher can monitor the progress of each status update in real time. The portable radio can operate through the vehicle using the mobile repeater system, known as MRS. This will connect your portable radio to RavNet through the vehicle radio over a range of up to 300 metres from the vehicle. However, if you are in a major population centre, your portable can connect directly to an operations centre by using the appropriate channel for that area. Major population centre coverage maps are detailed in the RavNet user guide.
Previously we've had GPS in our current radios, but they really haven't given us all the functionality that we require.
At the moment, when a crew actually presses their duress alarm, we've actually really got no idea, or very little idea, of where that crew actually is as far as location.
The duress button is in the new RavNet system is an enhancement on the old system. The really important features though are the fact that the duress buttons on the portables are now actually linked via the RavNet system and allow us to interface with the GPS in the cars.
With RavNet, what's going to be enabled is that when a crew sets off the duress alarm, we will then be able to see the precise location of where that resource is to allow appropriate resourcing for that event, say police backup.
RavNet also offers greater security and protection for the paramedics on road because it also has 3 duress buttons, not just the one. Through GPS they can locate us directly, getting help to us if we need it.
A new feature of RavNet is the capability to make a phone call. If you need to make a phone call to contact a hospital and request a medical consult, simply use the keypad on your RavNet radio, dial 0 and enter the number you need to be connected to.
Good afternoon, Bellway Base Hospital, Dr. Fisher speaking.
RavNet is preferable to using your mobile phone because all calls are recorded for audit purposes.
AVL, or Automatic Vehicle Location, allows the Operations Centre staff to see which vehicle is the closest to any incident at any given time, and that's a substantial feature that allows us to get to patients far quicker than what we currently have. It's also linked in with cars' proximity to each other, so we can accurately determine who will get to the case in the quickest amount of time, and that's something that we currently don't have.
The new features of RavNet create greater coverage, are easy to use and provide better safety. RavNet will assist RavNet paramedics and dispatchers to improve communications and response times across the entire system.
In the past, the old system didn't allow us to actually talk car to car or actually talk to resources that were coming to assist us. The new RavNet system will allow us to have vastly better interfaces with other emergency services, particularly Metropolitan Ambulance Service.
Find out more about RavNet in the RavNet User Guide.